Hello class, my name is Trisha Miller and today I'm going to be talking about diversity. Diversity is the core value for this 8-week course, Nursing 320. Diversity means that we are all different. There are different races, there are different cultures, and different religions. Race just means that we have biological differences. Culture is the habits and beliefs of a group of people after they have lived together for an amount of time. There are many different religions also. We all have very different beliefs. When caring for patients, we need to be aware of these differences. Our own beliefs can impact how we care for the patients. I'm going to be discussing how nurses can become culturally competent. To become culturally competent nurses and provide the best care for every patient, we need to perform a culture self-assessment, increase our knowledge about other cultures and how they affect a patient's reaction to illness, pain, and healing. The first step to becoming a culturally competent nurse involves performing a culture self-assessment. We need to understand our own culture, and I had to really think about this. In general, I think that West Virginians are friendly in nature and love family. We're very proud people also. This is an important thing to know during the pandemic because we are limiting visitors to our patients. Family is a very important part of West Virginian culture and affects both patients and their families when they cannot be with them during their illness. By knowing what our own culture is, we can then be aware of what the differences are for a patient that's from another culture. If we know the differences in the two cultures, we can provide better care for the patient. The second step to becoming culturally competent nurse is to increase our knowledge about other cultures and their beliefs. There are many things to consider about patients from a different culture. Can they speak English? Language can be a barrier to providing safe care. We can overcome this barrier by using an interpreter and providing education in their native language. Another thing to learn about patients from different cultures is what their beliefs are about illness. Some cultures believe that illness is caused by an imbalance to the environment. Others believe that illness is a punishment for something they did wrong. Nurses must also learn how patients from different cultures express their pain. We must be aware that remaining silent about pain may be something that patients from certain cultures consider important. This can make it difficult to assess their condition. Each culture also has different beliefs about healing and may use what we consider non-traditional treatments. It is important to ask patients if they are using herbal healing methods when obtaining a health history. An accurate health history ensures that the patient is not given anything that will interact. Nurses encounter patients from diverse backgrounds. We want to provide the best care for every patient. One way to do that is by becoming culturally competent nurses. We do not have to agree with the beliefs of other cultures. We just need to respect and be aware of the differences. Nurses should perform a culture self-assessment, increase their knowledge about other cultures and how they affect a patient's reaction to illness, pain, and healing to provide the best care possible. Thank you for your time. Again, I'm Trisha Miller. Thanks.